Good to have you with us in this edition of the Urban Debate. Viewers, like I told you last week, we will focus on specific states, their strategy for battling coronavirus, what's going right and what's going wrong. But tonight, we're actually going to focus on two big regions, two big cities and the satellite cities around them, which have the highest number of cases in our country right now. The national capital, Delhi, and then we will also talk about the financial capital, Mumbai. So let's begin with Delhi. 2,156 cases of coronavirus have been detected in the national capital so far. 47 lives have been lost. This is how badly the national capital has been impacted. And there is no relief in sight right now, viewers. And I will tell you how the cases have grown actually. We're going to put up a chart for you which shows how from March till now, till 22nd of April, the cases have gone up, and how the worry is actually what we've seen in the last 1 week, 10 days, the growing number of cases. So while on March 11th, there were about 5 cases that were reported in Delhi, by March 18, cases had become 10. Now by now, actually, the government had already reacted and come in with a first set of restrictions on people gatherings, on mass gatherings and public events. By March 25th, a day after the lockdown began, Delhi had 35 cases. By April 1st, that had gone up to 152 cases. By April 8th, Delhi had reported 669 cases. But by April 15th, 1,505 cases had been reported, and just in the last 1 week, viewers, we have now touched the number of 2,156, roughly over 600 cases in the last 1 week. Delhi is one of those states that has decided to not bringing any kind of relaxation as far as the lockdown is concerned. That is how seriously this is being taken. The number of cases, the spread, the number of red zones and containment zones. The problem also is with the cities around Delhi, from Noida to Ghaziabad and Faridabad. And we'll talk about that in just a bit as well. But first up, I want to go across to Mr. Satyendar Jain. Delhi's health minister, apart from holding several other portfolios, is with us right now on Mirror Now to give us insights into what the government is doing on ground, how it plans to tackle this. Mr. Jain, thank you for speaking with us. About 600 cases just in the last 1 week. Delhi, just like Mumbai, has one of the highest number of cases so far. How are we going to tackle this, Mr. Jain? What's the main strategy, considering you have decided to not bring in any relaxation for the lockdown?
देखिए, सबसे पहले मैं बता दूं कि दिल्ली शायद देश में अकेला एक राज्य है जिसने 20 अप्रैल से जो रिलैक्सेशन दी गई उसमें किसी भी तरह की रिलैक्सेशन को एक्सटेंड नहीं किया है। हमने जो पहले लॉकडाउन के स्ट्रिंजेंट कंडीशंस थी उन्हीं को बिल्कुल एज इट इज आगे बढ़ाया है, और दिल्ली जो है 3 तारीख को जब लॉकडाउन खत्म होगा उसके बाद ही रिलैक्सेशन की बात करेंगे। दिल्ली के अंदर मैं आपको स्टेटस भी बता देता हूँ। आज की डेट में 2156 केसेज है, जिसमें 75 केसेज नए कल आए थे। रिकवरी 180 केसेज की हुई। कुल मिलाकर 611 लोग रिकवर हो चुके हैं। दैट इज अराउंड 28% लोग जो है ठीक हो चुके हैं। अब दिल्ली के अंदर सबसे पहली बात तो है कि जो लॉकडाउन है वो पूरे देश में किया गया है, दिल्ली में भी किया गया है। सबसे ज्यादा इंपॉर्टेंस ये है कि लॉकडाउन को ठीक से लागू किया जाए और केसों को बढ़ने से रोका जाए। आज दिल्ली के अंदर 2156 केस हैं। एक्सपर्ट्स का ये कहना है अगर देश में लॉकडाउन नहीं होता, दिल्ली में लॉकडाउन नहीं होता तो कम से कम 100 गुना केसेज होते। जहां पर 2000 है वहां 2 लाख होते, जहां पर 20,000 है वहां पर 20 लाख होते। तो इसलिए दिल्ली के अंदर, देश के अंदर लॉकडाउन की वजह से जो इसका स्प्रेड है, उस स्प्रेड को मल्टीप्लिकेशन फैक्टर जो है स्लो डाउन हुआ। अदरवाइज तो अगर 3 दिन में डबल होते या 4 दिन में डबल होते तो अभी तक एक्सपोनेंशियली लाखों में केस पहुंच चुके होते। अब भी मैं लोगों से बस यही है, दिल्ली सरकार लगी हुई है कि लॉकडाउन को ठीक से इम्प्लीमेंट किया जाए, पब्लिक मूवमेंट कम से कम किया जाए, लोगों को बीमार होने से कम बीमार होने दिया जाए। अगर किसी वजह से कोई होता है तो उसका ठीक से इलाज किया जाए।
एक बड़ी प्रॉब्लम जो संडे को केजरीवाल जी ने भी हाईलाइट की, मिस्टर जैन, was the problem of asymptomatic patients. Now, what's the strategy there? Have you changed the way you're testing people? Because if people are not showing symptoms, how will they be detected?
उसके लिए देखिए, जो एसिम्प्टोमेटिक केसेज है ना, एसिम्प्टोमेटिक केसेज हैं, उसके लिए रैपिड टेस्ट किट ही कामयाब है। रैपिड टेस्ट किट हमने परसों से स्टार्ट किया था, पर केंद्र सरकार ने 2 दिन के लिए इसको रोक दिया है। मोस्ट लाइकली 1 या 2 दिन में फिर से स्टार्ट करेंगे। होता क्या है कि जो एसिम्प्टोमेटिक केसेज हैं उनका पता तो लगता नहीं है, और पूरी पॉपुलेशन को, बहुत बड़े सेक्शंस को जो नॉर्मल आरटीपीसीआर टेस्ट है उससे कर पाना संभव नहीं है, क्योंकि बहुत टाइम कंज्यूमिंग टेस्ट है, बहुत समय लगता है, बड़ा डिफिकल्ट टेस्ट है। तो रैपिड टेस्ट को बड़े स्केल पे किया जाएगा और उससे पता लग जाता है कि कभी जो इन्फेक्टेड हुए हैं, एंटीबॉडी उसी में बनती है जिसको कि इन्फेक्शन हुआ था। इन्फेक्शन होने के 7 दिन से लेकर 10 दिन के अंदर एंटीबॉडीज बननी स्टार्ट हो जाती है और वो लगभग 5-6 हफ्ते तक रहती हैं। तो अगर कोई आदमी 1 हफ्ता पहले, 2 हफ्ता पहले, 3 हफ्ते पहले कभी भी अगर इन्फेक्ट हुआ है, तो उसमें एंटीबॉडीज का पता रैपिड टेस्ट के बहुत बड़े स्केल पे करने से पता लग जाएगा और 2-3 दिन के बाद रैपिड टेस्ट को हम बहुत बड़े स्केल पे करेंगे।
क्या आपने जिस जहाँ रैपिड टेस्टिंग किट्स यूज किए वहाँ पे वहाँ वेरिएशंस मिले, कोई प्रॉब्लम मिली? बिकॉज द बिगेस्ट इशू राइट नाउ इज दैट दीज चाइनीज इंपोर्टेड रैपिड टेस्टिंग किट्स मे बी फॉल्टी।
देखिएगा, ये तो एक्सपर्ट्स ही बता सकते हैं। आईसीएमआर जो देश की सबसे बड़ी लेबोरेटरी है उसको वैलिडेट कर रही है। हमने जो टेस्ट किए थे उसमें सभी नेगेटिव आए थे।
ओके मिस्टर जैन, लेकिन जो है प्रिपरेशन तो थोड़ी वो करनी ही होगी कि अगले 1 हफ्ते, 10 दिन या 2 हफ्ते में कितने केसेस बढ़ गए। जैसे कि हमने देखा पिछले 1 हफ्ते में काफ़ी बढ़ गए हैं केसेस। क्या हेल्थ केयर इंफ्रास्ट्रक्चर की प्रिपरेशन हो रही है फिलहाल दिल्ली में?
देखिएगा, मैं आपको ये बता देता हूँ, आज दिल्ली के बड़े अस्पतालों में 513 पेशेंट हैं, सारे हॉस्पिटल मिलाकर, और बेड जो है वो 3000 से ज़्यादा है। तो वी हैव 6 टाइम्स बेड्स देन द पर्सन इन हॉस्पिटल। हम बिल्कुल तैयारी करके रख रहे हैं, अगर थोड़े से भी केस बढ़ेंगे हम और बेड तैयार कर देंगे। हमारे जो सबसे बड़ा हॉस्पिटल है एलएनजेपी हॉस्पिटल, उसमें 2000 बेड की हमने तैयारी की हुई है। राजीव गांधी में 500 बेड हैं। सभी अस्पतालों में मिला लें और फिर प्राइवेट को मिला लें तो 3500 बेड बनते हैं। तो हमने तैयारी की हुई है और हमने प्लान किया हुआ। जैसे मुख्यमंत्री अरविंद केजरीवाल जी ने लगभग 1 महीना पहले पूरा प्लान बताया था अपना, उसमें बताया था अगर 30,000 केसेस भी होते हैं तो उसके लिए हमने पूरा कॉन्क्रीट प्लान बनाया हुआ है। अब ये कहना कि भाई आज केसेस 500 हैं और हम 10,000 बेड तैयार कर दें, हमें बिल्कुल तैयारी है। किस किस अस्पताल को हमने कोविड में कन्वर्ट करना है, कहाँ पर बेड बढ़ाने हैं, वो बिल्कुल प्लान है हमारा।
एक ऑपरेशन शील्ड जो सरकार ने शुरू किया था, और पहले हमारी आपसे जब बात हुई थी तो आपने कहा कि एक स्पेसिफिक एरिया में उससे काफ़ी फ़ायदा भी दिखाई दिया है जहां केसेस एकदम ही बंद हो गए हैं। बट अब क्योंकि कंटेनमेंट जोन्स बढ़ गए हैं दिल्ली में, 87 हो गए हैं, हाउ इज ऑपरेशन शील्ड वर्किंग आउट फॉर यू मिस्टर जैन?
देखिएगा, इनका रिजल्ट 2 वीक के बाद ही पता लगता है। 3 शुरू के कंटेनमेंट जोन में, तीनों में हमारे को पूरी सफलता मिली थी। बाकी कंटेनमेंट जोन में हुआ क्या कि जैसे कंटेनमेंट जोन आज हमने बनाया, उनके बहुत सारे सैंपल लिए, तो उसमें कई सारे लोग फिर से कहते पॉजिटिव निकले, क्योंकि वो कंटेनमेंट जोन बने के बाद उसका इफेक्ट आने में कम से कम हफ्ता, 10 दिन, 15 दिन लगते हैं। तो कंटेनमेंट जोन में मैं मानता हूँ कि जरूर उसमें फर्क पड़ेगा। जहां पर भी कंटेनमेंट जोन बनाया जाएगा उसका इफेक्ट 1 हफ्ते, 2 हफ्ते के बाद पता लगेगा।
ओके फिलहाल जो फूड राशन जो गरीब लोगों को देना है, और आपकी सरकार ने इसमें कुछ अनाउंसमेंट्स भी किए हैं कि सबको मिलेगा और कार्ड हो ना हो। माइग्रेंट्स की बहुत बड़ी एक पॉपुलेशन दिल्ली में फिलहाल अभी भी है। क्या इसमें आपको सेंटर से कोई और मदद चाहिए?
देखिएगा, हमने ये कहा है कि जो भी माइग्रेंट हैं उनके खाने की और रहने की, 2 चीज़ों की चिंता दिल्ली सरकार करेगी। रहने के लिए हमने जगह जगह रैन बसेरे बना दिए हैं, खोल दिए हैं। इसके अलावा कई सारे हमने स्कूलों की बिल्डिंग खोल दी है उनके रहने के लिए, जहाँ पर 3 टाइम उनको ब्रेकफास्ट, लंच और डिनर दिया जाता है। खाने का इंतजाम किया गया है। तो मुझे जितने भी लेबर जो है जिसको बाहर जाने का मन था, उनके रहने का और खाने का इंतजाम हमने पूरी तरह से कर दिया है।
ओके मिस्टर सत्येंद्र जैन, एक जो बड़ा इशू रहा है वो रहा है कि जो हेल्थ केयर वर्कर्स खुद हैं उनको जो प्रॉब्लम्स हो रही हैं, अटैक्स हो रहे हैं, उनको सोसाइटी से निकाला जा रहा है, हरास किया जा रहा है। एंड ऑफ कोर्स अब एक दिल्ली में ही हम देखें तो काफ़ी लोग खुद इन्फेक्ट हो चुके हैं। अबाउट 35 नर्सेज हैव आल्सो बीन इन्फेक्टेड। व्हाट इज द गवर्नमेंट डूइंग टू एंश्योर द सेफ्टी ऑफ आवर हेल्थ केयर वर्कर्स?
देखिएगा, सरकार ने अपनी ओर से हर तरीके की कोशिश कर रही है। आज केंद्र सरकार ने भी इसका अध्यादेश लेके आए हैं, जिसका मैं स्वागत करता हूँ कि अध्यादेश का जो आपने 35 नर्सेज की बात की, उसमें 23 एक ही हॉस्पिटल की हैं। वो कोविड हॉस्पिटल नहीं है, दिल्ली स्टेट कैंसर हॉस्पिटल था। वहाँ पर कोई एक डॉक्टर को इन्फेक्शन हुआ था, उसकी वजह से 2 डॉक्टर और टोटल 26 लोग उसमें इन्फेक्ट हुए। तो ये कहना कि भाई हेल्थ केयर वर्कर को हॉस्पिटल से ही इन्फेक्शन हुआ, ऐसा नहीं है। कहीं से भी हुआ है, वो भी सकता है, दूसरी जगह से भी हो सकता है। और जो भी है उनका हम केयर कर रहे हैं, सारे ठीक हो चुके हैं। हमारे यहाँ पर जो 26 लोग थे, 26 के 26 क्योर हो चुके हैं, बिल्कुल ठीक हो चुके हैं।
मेरा आखिरी सवाल आपसे, और जो जिसके बारे में हम आगे भी इस चैनल पर डिस्कशन करेंगे, नोएडा के साथ जो बॉर्डर है वो सील कर दिया गया है, वहाँ काफ़ी रिस्ट्रिक्शंस आ गए हैं। गाजियाबाद का भी बॉर्डर सील कर दिया गया है, और हम पिछले 2-3 दिनों से देख रहे हैं कि ट्रैफिक जैम्स भी हो रहे हैं वहाँ। आज़ाद मंडी में जहाँ अब एसेंशियल गुड्स और आने लगे, वहाँ पे काफ़ी भीड़ भड़क्का हो गया है। पुलिस के होने के बावजूद वहाँ पे सोशल डिस्टेंसिंग बिल्कुल नहीं मेंटेन की जा रही है। क्या आपको लगता है कि ये कुछ और चैलेंजेस है जो अभी रिजॉल्व नहीं हो पा रहे, जिसमें दिल्ली सरकार को शायद दूसरे स्टेट्स के साथ और दिल्ली पुलिस के साथ कुछ और स्टेप्स लेने पड़ेंगे?
देखिएगा, अपने जो नेबरिंग स्टेट से उनसे बात कर रहे हैं, खासतौर से जो हेल्थ वर्कर्स हैं, जो हॉस्पिटल्स में काम करने के लिए आ रहे हैं, और जो सिक्योरिटी फोर्सेस के लोग आ रहे हैं, उनको अलाउ करना चाहिए। उसके लिए हम बातचीत कर रहे हैं उनसे।
और आजाद मंडी में के जो सीन हम 2 दिन से देख रहे हैं
जी, उसके
सत्येंद्र जी,
अंदर
उसका क्या
देखो,
करेंगे
आजाद
वहां
मंडी
पे?
को 24 घंटे के लिए खोल दिया गया है। अभी जब 24 घंटे, लोगों को ज़्यादा पता नहीं था कि कैसे खोला गया है। मुझे लगता है आज से स्टेबलाइज हो जाएगा। लोग अलग-अलग समय पे आएँगे, अलग-अलग समय पे आने से वैसी भीड़ कम हो जाएगी, और 24 घंटे खुला हुआ है। और ट्रक्स का मूवमेंट जो है वो रात को रहेगा, रात को 12 बजे से सुबह 6 बजे तक रहेगा। तो उसकी वजह से मुझे लगता है काफ़ी स्टेबलाइज आज से हो जाना चाहिए।
All right, Satyendar Jain, thank you so much for speaking to us here on Mirror Now and giving us an insights into what is happening. Yes, there are some still problems, especially including travel between Delhi and the neighboring cities of Gurgaon, of Noida, Ghaziabad and Faridabad, and there now we are beginning to see problems at the border which need to be resolved. Of course, within Delhi also there are examples where social distancing are not being followed that need to be looked at. Let me also go across and say good evening to Anila Singh, National Spokesperson for the BJP, and Dr. Suranjit Chatterjee, Senior Consultant Internal Medicine at Indraprastha Apollo Hospital, joining us right now. Dr. Chatterjee, I'm going to pick up from one of the points that Satyendar Jain also referred to, which is the rapid testing kits. Now, cities like Delhi and Mumbai would have used it for larger surveillance to look at larger scope of population. Right now, that's not happening. Then what do we do? How do we ensure that we are still able to test enough and mark out the zones which need specific attention?
ICMR for the moment has stopped the use of this rapid testing kits. Obviously, in the next 1 or 2 days, we have to see what is happening, because other than that, we have to really ramp up the testing, because if we don't ramp up the testing, we will not know which the containment zones are, which the red zones are, because as the things, the lockdown period finishes, we should have a clear-cut idea as to where the restrictions have to go on, which have to be opened up totally. So that is very important. If these kits don't work, unfortunately, we will have to go back to the RT-PCR testing, which is the most standard way of testing. But obviously, as everybody is saying, that it requires a lot of timing, it requires a lot of time, money, and also expertise. The rapid testing kits are much more easier to handle, but these things have to be validated first before we start using them for surveillance purposes.
Yes. The other part, of course, is that Delhi has extended the lockdown. We've been now in a state of lockdown for a month, but we are not really seeing the cases reduce so far as Delhi or Mumbai is concerned. What further needs to be done, or do we just prepare ourselves for a longer period of restrictions?
I think we'll see this once the lockdown finishes, this is not the end of coronavirus infection. Obviously, we have to be all prepared. Our lifestyles have to change for a much longer period of time. We have to maintain this physical or the social distancing for a much longer time. But this lockdown period has given us enough opportunity to ramp up our medical services, to be prepared that if the number of cases go up, we are able to tackle them on time. Also, what it has given us is basically the entire preparedness has been happening. Now, the other thing is that these kits have to come through, the investigations have to start significantly.
Okay, all right. Let me go across to Anila Singh. Anila Singh, as we actually look at cracking down on violators while also providing safety to the those people who need to step out, the healthcare workers, even the government officials who have to go to work, even the media personnel who are out there, how do we ensure that they are safe, they are provided safety, and they're not attacked in the city of Delhi?
Tanvi, your voice got cracked, but what I can recollect is that you are mentioning that how the government officials or the medical people who are going into the areas, how they can be, how their security is assured. Perhaps you're asking me this. If it
Yes.
is so, yes,
Yes.
Tanvi. Your concern is absolutely correct. When we see such attacks on the police personals or the or the people coming from the medical faculty, I mean, this is very unfortunate, and it really concerns everybody. The thing is, when like the medical people can be given the security by the police, but what to say when police itself gets attacked by the people who do not want to cooperate to get themselves tested, or when police tells them that you do not have to collect at one place, it is for their own good, but in return they are being attacked. But at the same time, like in the press conference also today, Mr. Javadekar mentioned that strictest of action will be taken against all those who are attacking the government authorities in any form. So it is not only the exemplary punishment which will be given; they will be fined. And above all, I just want to say here, Tanvi, it is the responsibility and the duty of the society as well that these people are coming for you. I mean, they are not taking anything from you. They are there because they are concerned about you. So definitely, I think until or unless the society and the government, they both are going to come together, it becomes very difficult. Because if we talk about other platforms, if we talk about say media, I mean day in and day out, all the media platforms, say electronic, print or social, everywhere we can see the media persons, doctors, government officials, everybody is telling that you have to keep social distancing. If you get any symptom, please call. Like everything, whatever a government can do, right from the center to the state governments, they are doing that. But it is very unfortunate when we see that people, they love or somehow they get thrilled when they flaunt these rules which are or the advisory given by the government.
Yes, that is unfortunate, and that becomes the biggest challenge. Ajay Kumar of the Aam Aadmi Party also joining us right now. Ajay Kumar, there has to be a strict example that's set for the lockdown violators. Cities like Delhi, actually nowhere in our country can we really afford any kind of a mistake and people showing callous attitude. We seem to have some problem with Dr. Ajay Kumar's line there. We're going to get back to that in just a bit. Let me actually go back to Anila Singh on this other issue. Anila Singh, fact of the matter is Delhi is also a little tricky because there are people who live in Noida, who live in Ghaziabad, and in Gurugram, or the other way around, live in Delhi, but they have their workplaces there and they have to travel. This is actually becoming a problem. Even on borders, we are seeing a lot of traffic jam. How do we resolve this problem?
Officials, they are like any person, right from the officer to any grade, like they have got their own identity cards, so they can show it and they can cross the borders. And at the same time, again, the NBA has requested from the UP government that they should be allowed to cross the borders by showing their identity card, because it will become a very chaotic if they have to line up in the offices to get the pass. So I am pretty sure that the DM Gautam Budh Nagar is going to take some positive step regarding this. But at the same time, because we are seeing the increased cases in Delhi, Ghaziabad and Noida, so now the government authorities, they have become more strict so that the cross-border border traffic reduces somehow. But at the same time, there are many people, like if you talk about the say about the doctors and the nurses and other people also, or the media, they have to go to their offices, and I'm pretty sure that government is going to take it in concern, and somehow some way will be there so that no traffic jams are there, and they can cross the border without giving any sort of alarm for the coronavirus infection.
All right, let me go across to Dr. Ajay Kumar also on this, because Dr. Ajay Kumar, it's a very unique problem that people's lives are interconnected in Noida and Ghaziabad and Delhi and Gurugram, and we are now beginning to see huge queues at the border.
Yeah, so Tanvi, I think the coordination between the three governments, we need to make sure that the people who are fighting, because a lot of people, government officials, a lot of doctors, a lot of people who are involved in providing services all live in NCR and work in different parts of the NCR region. Somebody is working in Delhi and has to go to Faridabad. Somebody in Faridabad has to go to Noida. So we need to get this resolved immediately. It needs a better coordination. Totally agreed with because the traffic jam itself will lead to more chaos. So the systems are a clear identification of ID card. If the government officials or doctors are only crossing, then it's very easy to check them. And you can check them, before the toll or the borders. Maybe 1 kilometer before the Noida border, or 1 kilometer, 500 meters before the Delhi border, and vice versa, so that there are no jams, and you have a much more smoother system of movement of people.
Yes, the other problem also is of violations that we are seeing in the city, Dr. Ajay Kumar, and I gave the example of Azad Mandi earlier. For 2 straight days now, our reporter has been there showing us visuals in presence of the police. There's absolute disregard of social distancing. Now, I'm sure it's a very simple thing to do. You only allow a certain number of trucks to enter at one point so that there isn't so much crowd inside. Are we failing to ensure that as more and more essential goods movement happens, that social distancing doesn't get violated?
So those are challenges that we across. I mean, I agree with you. Now we need to make sure that the number of people who are entering into the mandis are much smaller. We were trying to do it through the odd even, and extend the timing of the mandi for maybe 18 hours or close to 18 hours. So that in different groups you can get people coming in. Those are challenges we have to see. You can only look at a democracy. There is so much you can only educate and request, especially and advise, and then put up the. So those are definitely challenges. And as we go out of the lockdown, those challenges are going to remain. One of the most important thing, like my colleague before this was telling, that you need to now start slowly opening up, definitely, but most important is the testing part. We need to identify those people. Rapid testing and antibody testing is much faster. The PCR reverse transcriptase testing takes time. Not only expensive, it is also time taking, and by the time you get the results, so we need to find out a gold standard for rapid testing, and then do a huge amount of testing, so that the moment you identify people, you immediately isolate them. Otherwise, the latest report about even trucks on the highway, Tanvi, the drivers are not there. The next crisis is going to be supplies. So we have to resolve this quickly. We need to find the truck drivers. We need to do the testing. We need to ensure the supplies. Otherwise, we will be looking at even Corona plus a larger, food supplies and essential goods challenge.
So I understand what you're saying, but in a scenario where there is a big question mark on these Chinese rapid testing kits, What are the other options? Has Delhi by itself ordered rapid testing kits from other countries, or is trying to source it from somewhere in India where they may be under process? What's your other option for rapid testing kits then?
So one of the things which is coming up is that the ICMR has approved a large number of Indian testing facilities. Now the protocol, you see, the testing for the Indian companies, the protocol for identifying and making sure you test it against the antibodies, the gold standard antibodies, is only from a COVID infected patient. Now the ICMR has to make sure that we get those plasmas with this COVID infected patients for the Indian diagnostic companies to create the kits and do their testing on, to create the standard. That is still not happening. So, to you, and it would be an interesting story for you to do also, is that the ICMR now needs to get the governments to supply the identified Indian company to provide them with the plasma so that they can do the standardization of their test. Wait for the Chinese, wait for the other countries who have got better equipment, yes. But in India also, the diagnostic companies who have been approved by the ICMR are not able to conduct it because they don't have the antibodies, which should be accessed only through the government hospitals providing them those antibodies.
Dr. Chatterjee, would you want to weigh in on this? What Ajay Kumar is saying as far as testing is concerned?
See, we all have been saying that the testings have to really go up. There's no doubt about it. But how many days can we wait? So the ICMR has to really work very hard and validate these testing kits. If they are not able to validate these testing kits, as I've told earlier, that we'll have to fall back upon our RT-PCR test, which is the most standard testing, but unfortunately it is expensive and time consuming. The other thing which we can think of, if suppose these kits don't work out, the other things which are obviously the ICMR and the government authorities have to think about it, can we do some pool testing, RT-PCR pool testing, and can that help us in the long term? But obviously the rapid kits have to be validated as the previous gentleman said, that we have to have Indian companies also getting into it so that we can find all these testing kits in the country itself. Obviously, other countries, the ICMR is also, I'm told, ordered from South Korea and other countries, but we really don't know when are they going to appear, and we cannot go on wasting our time because the days are really limited to ramp up the tests.
Yes, I think that's increasingly becoming the biggest challenge that we have right now. The other aspect, of course, is of asymptomatic patients, which is a huge problem right now. Again, we run into a trouble there because of the fact that we don't have enough testing kits and we're not doing enough testing. So how do you identify these people? But, let me come to the other issue that we've been speaking about. Dr. Ajay Kumar, ensuring the safety of the healthcare workers. And before you joined us, this is the conversation I was having even with Anila Singh. A new law is being brought in. Now, will that help? What else can be done in ensuring that our healthcare workers who are at the front line of this are fully geared up, they have enough safety equipment, and they don't get targeted by the people?
Tanvi, the first thing is, I think, in terms of availability of the equipment, in terms of the doctors and the people who are getting in touch, there has been a significant progress. Obviously, not there will always be some amount of shortages, but I think that is to a large extent being resolved by all concerned: the government of Delhi, the government of India, the various organizations across. In terms of that, the other thing is in terms of safety of the doctors and the police officers. The action is a registration of FIR, taking all the delinquents to be arrested, and strong steps being taken. I think the moment you register an FIR and take legal action, and once the TV channel like yours and everybody else and the news media covers it, I think it will have I'm sure it will have a significant impact. And continuous exposure of such kind of activities. Whenever it happens, wherever it happens, identification of people, and then the registration of cases, irrespective of whatever their background, and strongest legal action in terms of attacking the people who are doing their job. I think that is something, and it also applies to RWAs and colonies and so-called self-declared, proclaimed, leaders of the RWAs who ostracize healthcare workers in their colonies. I mean, all this also is against action against them, action against people who attack healthcare workers and police officers who go for implementing quarantine or shutting down or doing a lockdown, implementing the SHIELD program in Delhi. We need to make sure that all such people, the strongest action legally again, is taken by the authority.
All right, I'm completely out of time on this conversation, so I'm going to thank all our panelists for joining us right now. Viewers, Delhi is a big concern, a large number of cases and increasing at a very fast pace. We've got over 600 cases just in the last 1 week, and the number has now crossed 2100. Delhi is one of those states that decided to not bring in any kind of relaxation as far as a lockdown is concerned, but the challenges remain. There are still lockdown violators that continue, and with rapid testing now on hold, that's further added as a big challenge to the government strategy in finding and isolating COVID patients, keeping in mind that there are a large number of patients in Delhi who are also asymptomatic, and that becomes a problem. So we will keep a close watch on how Delhi is handled, and we will keep getting you more updates. That's as far as the national capital is concerned. I'm going to take a very short break. On the other side, we put the spotlight on India's financial capital, Mumbai, with the highest number of cases. What's the plan there? We tell you. Stay with us. Welcome back. Maximum city right now looking at maximum danger here as well, with over 3,400 cases just in the city of Mumbai. It looks like we've become the national hot spot, and we're emerging with worse statistics on a daily basis. Even the doubling rate, which is usually the number of days it takes for number of cases to double, is reducing. For example, it took us about 6 days to go from 1,000 cases to 2,000 cases in the city of Mumbai. But it only took us 3 days to go from 2,000 cases to 3,000 cases. So yes, Mumbai is now actually one of the biggest concerns that the entire nation has right now in terms of the number of infected cases that are emerging. Now, in the light of this, there is a team even from the center that has flown down to the city of Mumbai. It's currently in the city of Mumbai and looking at various implementation and strategies of the state government and levels of preparation. We found out that they actually have a 4-point task that has been cut out for them. This actually includes point number 1, looking into the implementation of the containment strategy. How is it is being done, not just in Mumbai, but we are given to understand they'll also look at Pune at a later stage. They will also study the rollout of the entire Disaster Management Act itself here in the city of Mumbai. They're going to evaluate the state's testing strategy as well. What are the norms and the protocols that are being followed? What's the criteria? Are we testing enough? Not? Are we turning away some patients? And of course, they will also look at a plan to deal with large number of outbreaks. Yet, while this is what the center is looking at, there are many challenges for Mumbai. And I just want to list out 6 basic challenges. Why having a conversation about Mumbai, just like we did about Delhi, is extremely important. 5 of the biggest private hospitals in the city are shut right now. Over 150 healthcare workers themselves have been infected in the city of Mumbai. There is a rapid corona spread that's taking place in one of the biggest slums that we have in this country, which is the Dharavi slum. And on a daily basis, a large number of cases are being reported from there. It's become a big challenge. Then, of course, there is pressure to restart some kind of economic activity. This is the financial hub of the country. It also, at some point, needs to look at that aspect. Let's not forget that Mumbai has a very intense monsoon season. A lot of preparation has to happen before that. And so one would actually like to see us at least get rid of maximum cases and cure them and have least amount of cases before the onset of monsoon. But what we are looking at instead is that the doubling time has now reduced from 6 days to 3 days. So what do we do? First up, I want to go across to our reporters who are joining us. Ayushman, who's been tracking all the updates from the center, and Mayuresh, who's been tracking all the updates from the state here in Mumbai. And Ayushman, let's come to you first. What have you learned from your sources about this team which is visiting Mumbai right now from the center? Why are they here?
Well, Tanvi, 4 states. We have West Bengal, Rajasthan, Madhya Pradesh. In Rajasthan, we have Jaipur. In Madhya Pradesh, we have Indore. In Maharashtra, we have Pune and Mumbai also. And in West Bengal, we know several cities like Jalpaiguri, North Parganas, Kolkata. There, the central teams have gone to look into what is happening on ground, because what the center has felt that the hubs, the hotspots and the containment zones and the number of cases that are coming to light are more in number when you consider these places. So the central team is there because it has to assess the situation on ground. What is the norm that is being followed in terms of social distancing? How equally prepared is Mumbai and Pune? What is the status of hospitals? What is the supply of PPEs? And how are the social distancing norms being followed or not? This is the overall idea which the team will get when they visit on ground. They are there in Mumbai. We have seen the reports from Kolkata as well and West Bengal as well, Tanvi, where the state government has expressed some sort of dissatisfaction. But we have seen Rajasthan and Mumbai also, where they have cooperated and they are ready to deal with it, because the kind of numbers that we are getting from Mumbai, like you pointed out, is definitely worrying, and these teams will go on ground and will assess the kind of situation that is prevailing there.
Okay, so this is why they are here, and they're going to multiple states, but Mumbai is a big concern. And Mayuresh, what you seem to have learned from your sources is this is actually not their first visit. This is the second time a central team has come here. What has been their interaction with the states like?
We have learned from our sources that this is not the first time the team is coming. Earlier this month, somewhere around 16th of April, the first time the team came from the center, which met the BMC officials, and they did discuss some figures related to the positive cases, and kind of a projection also they gave to the Mumbai city and the BMC, who is looking after the cases in Mumbai. So on the basis of those figures, BMC had started planning all such things since 16th of April. If you see that 2 days back, even the Maharashtra government rolled back the relaxation in the MMR region and Pune Municipal Corporation, because Maharashtra government is quite worried about Mumbai, MMR region and the PMC, because these are the two main hotspots in the Maharashtra, and continuously, if you see every day, the cases are rising. If you see today's number in single day, in 24 hours, more than 400 cases have got registered alone in Mumbai. So that's why they are quite worried. And as I said, that on 16th of April, my sources have told me that a meeting happened between the center team, which had all the way came from Delhi, who met the BMC officials, and they did discuss some projection related to the coronavirus cases, the positive cases for the Mumbai. And on the basis of those figures, BMC have planned further things. Back to you, Tanvi.
All right, Ayushman and Mayuresh, thanks so much for bringing us those insights. So as you now have heard, viewers, that one of the main areas that the center is also extremely concerned about is the city of Mumbai. And not only this time, but even before this, around 16th of April, there was a team of central officials who are in the city of Mumbai, interacted with the Mumbai civic body officials, the BMC officials, to take a stock check, take a look at the number of cases, the level of preparedness. So let's talk a little bit more about this, because 3,450 cases is a huge number collectively between Delhi and Mumbai. We are looking at a large chunk of the total number of cases that India has reported so far, which is why it's very important to ensure that these two cities get their strategy right. Let's say good evening to the panelists joining us right now. Sanjay Jha of the Congress Party. I also have Mr. Vishwas Pathak of the BJP, and Dr. Jalil Parker, senior consultant with the Leelavati Hospital, also joins us this evening. I want to begin with you, Sanjay Jha. 3,450 cases. It's interesting that we even thought for a bit that we can bring in some relaxation right now. They've been rolled back. But this is not the time to bring in any kind of relief.
Tanvi, at the outset, it's always a pleasure to be on your channel, which in the current environment has been one of the most responsible. So it's good to be taking your questions here, Tanvi. First and foremost, let's recognize one reality. Mumbai was always going to be a humongous challenge. It's a popular international destination. We got a very dense population here. There are huge clusters where you can see the concentrated citizens who live, the inhabitants. You have Dharavi is a classic example of that. So for us in Mumbai, we should have never been delusional about it. This would be a tough challenge. Now, the second point, I do want to point this out, Tanvi. I'm not trying to actually, just paint a very optimistic or a sanguine picture. But the fact that the cases have gone up is actually a sign. I would take it as a very positive one. And I'll tell you why. It means, one, that you are doing more testing. Frankly, there's no denying that there should be more testing done as well. But the fact that you're doing more testing is a sign that the cases are up. The second data that we need to look at very carefully, Tanvi, is the mortality rate, which is that the number of cases that have been reported and the number of people who have unfortunately died on account of coronavirus. If the number of cases go up and the mortality rate goes down, it means that we are actually getting good herd immunity, which is frankly the optimal way to go until the vaccine arrives. So the real problem that we need to confront, and I think Bombay is actually now looking, in my opinion, headed in that direction, is that any individual who's watching your program today, anyone who suspects himself or herself to have any symptom of a potential COVID-19, they should be able to get themselves tested, and God forbid if it's positive, they should be admitted and the treatment should commence, and hopefully they're out of it, because the mortality rates ought to be coming down to closer to 2 to 1%. And I think that's what we need to aspire for. I just want to make one point here. I read a report of some central team talking about 6,56,000 by May 15th. I'll be very honest with you, and I'm biting the bullet here. I think that to me looks pretty absurd, for the simple reason that, one, we don't know what is the mathematical model. But even if you're saying that the rates are doubling every 3-4 days, you are unlikely to hit those numbers. So clearly, this is not the time for fear mongering. This is also not the time to actually be cool and casual about the way we are. We have a problem. Coronavirus, we all know, is easily transmissible, and therefore everyone needs to be on guard. I also want to add one point here. You're right that the lockdown cannot be permanent, because the lockdown is not a solution. The lockdown only basically limits the transmission. So there has to be a fine calibrated balance. But at the moment, I would feel, as far as Mumbai or Maharashtra is concerned, frankly, even all India is concerned, if you look at the larger data, I think India is heading towards gradually flattening the curve. I would not jump and say we have successfully done it. But the fact is that at the moment, it does not look like there is a situation where you need to press the panic buttons, because you don't want the crowd to also begin to get paranoid and worried. I think the real thing is that the infrastructure has improved. The public health seems to be on a better angle, although there are questions being raised about, whether we should do more testing of contacts and tracing and so on. But I remain optimistic that you also can't do indiscriminate testing just because you want to make the figures look good. If you are saying that there are a lot of people who are asymptomatic, that is actually a sign that the mortality rate is lower, because the number of people who have died divided by a bigger base means the mortality rate is much lower. So I think there is a reason to feel confident, although I would definitely never be complacent at this stage.
Yes, you say that, but even now, Mr. Sanjay Jha, there are numerous reports that appear on a daily basis about the bad state of facilities which are existing even in the current hospitals, in the current quarantine centers. The main key hospital, Kasturba, has had a series of issues, and every time it gets highlighted, we are told we are going to fix it. But again, a few days later, similar reports emerge. So let's not also say that, we are completely ready with the healthcare infrastructure, because we are not. Because right now, with just 3,000 cases, if we are struggling so much, what happens a week later if we reach at 10,000 cases? Are we really ready for that, Dr. Parker? Dr. Jaleel Parker, would you want to come in? on that aspect of level of preparedness?
See, first of all, I think we should stop panicking about COVID-19. And I am repeating this again and again because the society is getting paranoid. You must understand that most of us, I would rather say nearly all of us, will be exposed to COVID-19. Now, once we know that we are going to be exposed to COVID-19, there are going to be around 70 to 80% who are going to be asymptomatic. The next 10-15% will be symptomatic. That means they will have cough, body ache, fever, headache. Maybe they might be having, gastrointestinal symptoms. It's only the 5% which are going to be critical. Who, out of those 5%, some might go into ARDS or they might go into multi-organ failure and eventually die. Now, as regards to Mumbai, you have to also understand the demography of Mumbai. 70% of our population in Mumbai is in the slums. Now, when we talk of containment and containment and containment, one really has to go inside into the slums to see in what conditions they are. And you cannot keep on having this containment again and again for days together or months together. It is going to worsen. People will come out on the road because they will not find food, which is essential to live. And number two is they won't have money to buy the food. And of course, the frustration is going to come in very shortly. Now, when you are talking about the surge that has happened in Mumbai, that is expected. So it's nothing new. Why it has to be so alarming? Now, as regards to the facilities, medical facilities that you are talking about in the city of Mumbai, city of Mumbai never will match any other country as far as facilities are concerned because we have constraints. And the curse on us is the population. So, hospitals have done their best. The government is doing their best. Remember one thing, that this is all new. This disease is new. We all are talking from our perceptive points of view. So the hospitals which are taking COVID, for example, you all spoke of Kasturba, then there is Nanavati, then there is Seven Hills. They are COVID positive hospitals. Having said that, most of the private hospitals have shut down because of containment. I will give an example. For example, let's go from Jaslok to Saifi to Wokhad to, I think that is Khar Hinduja, and there is one, there's another hospital. Now we are left with non-COVID hospitals, which could be only two. One is Lilavati, where I am there. Though part of it we have kept for the COVID isolation and the COVID ICU, and Hinduja. My earnest request to this government is that we are unable to treat the patients who are non-COVID patients. The fear psychosis is so much that they do not come to the hospital, number one. Number two, even though they come to the hospital, the process is such that they feel fear that they will be put into the COVID ward, COVID isolation ward, or in the COVID ICU, so they try to go back. So let us have at least a few hospitals which will be COVID free, because we are unable to treat the patients with diabetes, with hypertension, with COPDs, with renal failures. I mean, let's be very practical about this, and let us see to it that at least some hospitals are spared of COVID, so that, all the other patients can be treated. COVID psychosis is setting in.
Yes,
Today
which is
I
why
had
I
a
say,
young
Dr.
boy
Parker, there is still a lot
come to me.
that has to be done. Yes, Dr. Parker, if I
There
can
is
just
still
come
a
in
lot
there,
to be
which is
done.
why I say it is
Yes.
extremely important for
But
us
that- but-
to
but-
build on
but that-
healthcare infrastructure. Now, I named Kasturba Hospital because there is a report that came out
Absolutely.
just a couple of days ago of a 25-year-old young man who died after being there for 3 days. And before he passed away, the report suggested that he actually made these SOS phone calls to his family members saying, shift me to a private hospital. I haven't had a sip of water since the previous day. Nobody is here to even fix my oxygen mask. Do you think I will come out of this alive? Now, this is unfortunately also the reality even in cities like Mumbai, and we need to ensure that not even a single case like this actually takes place. So, Mr. Vishwas Pathak, this is going to be a big task. And 3,400 cases right now, but clearly if we are under the center's radar, the state and the center need to come together to build a stronger infrastructure here.
Exactly. See, if I'm not wrong, on 8th of April, Mumbai's total corona affected people were around 800. And today we are almost 4 times in the span of 12 to 13 days. And it is growing very fast, unfortunately. And I think center and state, they are trying to work together. From center, none other than Mr. Home Minister himself is in touch with CM, and CM has also acknowledged that. And rather, central government is very much concerned about Mumbai being epicenter of this whole COVID-19, followed by Pune. But all what I'm saying, that doctors are really doing a wonderful job. They are giving their 24/7 services. However, being a state government, somehow they are not able to come out of this panic. They are still under pressure. They are trying to show that we are performing better than what we are. I think instead of that, their approach should be to tackle this situation, no matter what it is. Let us disclose whatever cases there are. Like in this Nayar hospital, this patient was admitted as a COVID patient, but then when he was died, he was shown as non-COVID patient and all those things. I think there has to be proper consistency, and situation has to be handled
Right.
with iron hands. And the way this Dharavi, it is a kind of bomb. Dharavi is really multiplying like a bomb. I think we need to really concentrate on such aspects. And there has to be more and more powers, freedom given to the police without interfering. And I think Center has rightly sent a team at Pune and Mumbai. They're examining where exactly more efforts can be put in, how to bring down this number, and they are trying to work with the state government.
Well, let's wait and watch. The idea for today was to get all different varied voices here on the channel to talk about the two biggest cities with the largest number of cases, and the national capital and Mumbai. And if we have to win this war against corona, we have to start from these two cities, which are the national capital and the financial capital, literally the nerve center of this country. Here is where we need to begin tackling the number of patients before we move on. And so we need a clearer, stronger strategy for both of these places. As we speak, we've got the Maharashtra Health Minister giving a news briefing where he's saying that our doubling rate has actually now come down to 7 days. We're going to increase the surveillance, which will help us to increase the doubling rate. I don't know how, because the rapid testing kits have been put on a hold for now. He's also saying that we're not going by the numbers projected and working on WHO and ICMR guidelines. There's a lot of controversy that happened about one newspaper report that said that a central report, investigation apparently projected a large number of cases for Mumbai. But we're not going to go as per those projections. We will only give you what has officially been told by the central and the state government, which is this: the Two trips have been made by a central team to the city of Mumbai, because this is how serious the situation here is. Thank you so much for joining us on this conversation.